The the way that we always have thought about chronic care management is very similar to how you might view the dashboard of your own car. As an example, if you had no mechanisms to understand how your car was doing, you would wait until it broke down and only then would you take it into the mechanic. And if we think about every single person that's driving on the road doing that, eventually that mechanic is going to become very overwhelmed and stressed because they're having to deal with complex issues that could have been prevented if only you had brought the car in 2 weeks ago. And you repeat it after, car after car after car. It's no different as it relates to patient care and physician management or burnout. The challenge with healthcare today is patients cannot get a hold of their providers when they need them for simple things. So they wait and they wait and they wait until it becomes so urgent that they have to get in touch with their doctor. And so then they might call 5, 10, 15 times. They'll reach out through their portal. If they can't get a hold of you, guess what? They're calling 911 and 911 is answering. The way we like to change it is you use chronic care management as your proverbial dashboard in your car. And the care managers that are engaging with those patients are keeping an eye on those key status measures. If, for example, the patient's blood pressure is consistently too high, that might require a more early visit instead of waiting for 3 months for that patient to come in when their blood pressure is all over, it's having impact on their kidney function, they're dealing with swelling in their legs, and now all of a sudden they progress to a worse kidney stage. The simplest way to think about it is rather than waiting for things to become dire when the provider must be involved, instead handle these issues before they become major problems so that way they never have to make it to the provider in the first place. Now you're saving the provider's time for only those issues that are most complex and relevant to them and their specialty. So you will reduce the total volume, but you will increase the level of complexity in care that that provider is delivering. And that really is the essence of what we want with this type of care. You want your medical assistants or nurses to manage non-complex patient issues. You want those complex issues to wind up escalating to the provider so that they can use their medical decision-making to determine the necessary course of action. The challenge is right now, every single patient issue is always urgent because they're waiting until it's too late. So it has to go to the provider. And oftentimes the provider's only answer is, okay, we'll get them in for a visit immediately or put them in the ER. There is no addressable or possible outcome when the patient's conditions regress to that point. And obviously providers don't want to see their patients constantly getting less healthy. That leads to physician burnout when they can't see the work they're doing actually driving change. And so the main point is you address the issue before it ever becomes a problem, and you make sure when the provider is involved, it really is necessary for them to be involved, not just them looking at a train wreck where they have to send the patient to the hospital and they think to themselves, oh man, if only I had the chance to intervene 2 weeks earlier, it would be a completely different story. Give them the chance to intervene 2 weeks earlier where they can make a difference and see the impact of their work. You'll significantly reduce physician burnout.